Hi, I'm Mike Corrigan. I'm the president of the Proviso Township Mental Health Commission. The Proviso Township Health Commission recognizes that there's mental health issues all over, particularly in schools, and we feel it's important that we support agencies that are able to provide services to these middle schools, and that's why we're involved.
Strengthening Family program started with us in 2002. Currently it's being funded with Proviso tax dollars, and it's a program that we use to help families develop communication skills with adults and children. We're excited to bring this to the schools today.
It's been like an amazing experience. It has taught me a lot of ways where I can be more open with my family and talking out problems that have happened.
This program was developed by Dr. Carol Comfort with some grants through the NIH. The outcomes being that it has been proven to reduce substance and drug use among youth because it enhances the family connection.
So they explain what we could do, what's supposed to not do, and how encourage our kids more listen attentively to them and understanding and evaluating. So that one, it helps a lot.
The township has been able to fund this program for families because it actually helps them increase their communication, the rules that they set in their home, they're monitoring their children more, and so they're preventing problems from happening instead of reacting after the fact.
You know, strong families just help the community. It's important that the kids have a good environment to grow up in. So we feel fundamentally at the foundation level is that they have to have a good support system, and the family is that support system, you know, from day one.
They're given that structure and those skills to be able to have tough conversations, and for youth to come home to their parents and know that their parents are actually going to be able to listen to them, validate them, hear out their feelings, and come up with some sort of solution. And that could be with drug or substance use, or even if it's like having trouble in school, bullying, and now after the pandemic, just the increased anxiety and depression that youth are having.
What are some of the big things that schools experience today? You know, what are the bigger problems? And today, with the, vaping is a big thing, sexting is a big thing, and the school is really trying its best. But you know, there's a lack of resources. So what we're trying to do is bring additional resources to the school at no cost to them, because sometimes budget is an issue. So the Proviso Mental Health Commission at that point can step in and bring in some of the local resources that we have. We already fund 22 different agencies, 56 different programs. So those programs are all available to the school.
Nos ayudó muchísimo en cuestión de comunicación. Ellos son muy tímidos en cuestión de hablar y comunicarse con más personas. El programa a mí nos ayudó bastante porque en un principio ellos no podían comunicar y mucho menos estar aquí al frente de ustedes. Los programas que teníamos y mucho nos ayudó era el tiempo de familia, el que le dedicábamos tiempo a cada uno. Eso nos abrió las puertas para que ellos pudieran tener más comunicación conmigo y poderse comunicar lo que le pasa afuera y dentro de casa.
We can also be, culturally sensitive. We can be linguistically sensitive. So we're able to provide this in many ways. But the goal is to be able to continue to expand the program in schools, to be able to not only hear from the schools, but from the families as well. I think that's where the Proviso Mental Health Commission is best, is identifying what those needs are and being able to provide the resources for those schools that want it, for the families that need it, and it's for the long-term benefit of the township. Because if we address it today, we won't have to deal with it tomorrow.